Hi everyone, I'm Dr. Precious Kisha O. Cosinero, and I'm a doctor from Northern Mindanao Medical Center, or previously known as Provincial Hospital. So I was asked to talk a little bit about Cushing disease or Cushing syndrome. So the syndrome is most commonly caused by the Cushing disease or hypercorticolism. So this is caused by an excess amount or excess exposure to cortisol. So the body is making an abnormally excessive amounts of cortisol. Usually this is caused by a tumor in your pituitary gland or an adenoma in these areas. That's why the body is making a lot of cortisol. So, what can you see on a person physically with Cushing disease? Number one is really they're very cute because they have a round face, a fat face, and they have a fat back of the neck, or what we call a buffalo hump. So the patients they have a round face, and that's what we call a moon fascie and the buffalo hump. For females with Cushing syndrome, they don't have menses or they don't have menstruations. And for males, they don't have sex drives. So there is another cause of Cushing syndrome, which is caused by excess intake of cortisol or glucocorticoids or steroids. So before, there were a lot of salesperson who sells these corticols and sells them as vitamins, but they're not vitamins, and they say to the parents that these vitamins can make their child become healthy or become uh, chubbier. And it's true because glucocorticoids prolonged use of glucocorticoids can make the child fat. Really, they look fat, but they're not healthy. They don't run as fast as the normal kids because they are just fat looking, but they don't have the health or the vigor of a normal kid. So these are the causes of the Cushing syndrome. So what else? When these symptoms are present, the patient should go see a doctor because there are a lot of organs involved. The kidneys, mostly of the patient are hypertensive already, so the heart could have a problem already. So just to emphasize again that Cushing disease, Cushing syndrome, and a Cushing triad are present in medical dictionary, so you must know the difference between the three. So the Cushing syndrome is caused by the Cushing disease, and the difference is that not all Cushing syndrome is caused by the Cushing disease because when the example I gave, the children who takes the vitamins but it's just steroids really, that's not a Cushing disease, but they exhibit the Cushing syndrome. So I hope you understand that. And the Cushing triad is a different one, but with the same name. This is a triad when the patient has a neurological problem. So this is different from the Cushing syndrome or Cushing disease. And I hope that at this point in your school or in your learning, you know the difference and that you don't take any medications that is not prescribed by a doctor. So I think that's all. Thank you.